Merry Christmas and a Happy New Year. The COVID-19 era is here. Don't forget to play your part, especially during the festive seasons. Life goes on despite the COVID-19 pandemic. We must break the chain of COVID-19 infection for the safety and health of all. How do we prevent ourselves from getting the COVID-19 infection? Avoid these 3 C's: crowded places, confined spaces, and close conversation. If you cannot avoid it, please make sure to maintain at least a 1 meter distance from others. Face masks reduce the risk of infection for those who use them. Asymptomatic carriers of COVID-19 are hard to detect physically unless COVID-19 tests are done. Wearing face masks can help to prevent the spread of COVID-19. Besides, wearing face masks can help you to save money because it is an offense if you don't wear them. If you have been confirmed to have COVID-19, you will be contacted by the health authorities and transported to the hospital and later admitted to the ward. Absolutely no visitors are allowed. You need to follow the instructions given by the healthcare workers. So, what to bring to the ward? Make sure to bring your toothbrush, toothpaste, soap, shampoo, etc. Plus your underwear and other unmentionables, and also a towel. Remember to bring a pair of clothes to wear upon discharge later. You must keep your own belongings safe. Should you ever need assistance, please ask the ward staffs. What to do in the ward? Focus on getting well. Take your medications as instructed, if any. Cooperate with the ward staffs as they are trying their best to help you get well. Please abide to all the rules and regulations in the ward. Most important of all, rest a lot and eat well so that you can recover faster and go home soon. Packages from your family and friends can only be delivered if allowed by the hospital administration. You need to ask the ward staffs for further details about this. So, I am not working. What should I do? Please inform your employer about your hospital admission yourself. You will be issued a discharge note upon discharge. Please present the discharge note to your employer as soon as you can. Now, what if you are a contact? For each case of COVID-19 in the ward, he or she will be interviewed by the health staffs in order to do contact tracing. How is it done? 1. The case will be interviewed at the hospital. They will be asked about their list of contacts and details of places they went to within the past 14 days before their admission. Then, the health staffs will investigate further in order to track the contacts. They need to confirm whether the person is a true close contact or not. Furthermore, they need to investigate the relationship or interaction of the contact with the patient and get further information. The health staffs must identify the close contacts and those who have the highest risk for infection. If the contact is healthy, he or she will be asked to do the COVID-19 test and quarantine at home for at least 14 days. For symptomatic contacts, they will be referred to the hospital for isolation and further management. How do you define a close contact? A close contact is someone who has direct contact with a confirmed COVID-19 positive patient. If you are a close contact, you will receive a call from the health authorities. Annex 14A will be issued to you. You are required to be quarantined at home for at least 14 days. Make sure to fill in the home assessment tool daily. They want to know if at a certain date do you have fever, cough, or shortness of breath. Ensure social distancing of at least 1 meter from others in the same house. 2 nasal swab samples will be taken at different times. You will be informed regarding the date, time, and venue for the COVID-19 tests. For the context for home quarantine, if you have symptoms, please inform the nearest district health office. If not, just continue to stay at home and practice social distancing. If your result is positive, you will be transported to the hospital or to the designated quarantine centers. If negative, continue your home quarantine and social distancing. You can only be released once you receive the release order. If you broke the quarantine order, you will be punishable by law. If there is a sudden death at home, call 999. Wait for the police to come. The police will seal off the area. They will cover the body of the deceased with 3 layers of body bags. The deceased will be transported to the nearest hospital's mortuary. A post-mortem examination will be done to determine the cause of death. Caution! Please make sure not to get near to the deceased. We empathize with your sorrow and pain. For your safety, nobody is allowed to see the deceased. After the post-mortem, if the cause of death is not due to COVID-19, the family members can claim the body of the deceased for burial. However, if the cause of death is due to COVID-19, the management of the body of the deceased will be according to the strict guidelines. If you have any queries, please don't hesitate to contact the following district health officers: